This is Tom Akello Ochieng presenting to you female orgasmic disorders. What is female orgasm? The lack of a satisfactory definition of orgasm has been attributed to our limited understanding of the mechanisms underlying orgasm and our reliance on the subjective or self-report aspects of the experience. Orgasms have been described by women as a spreading sensation starting in the clitoris that then spreads through the entire pelvic and vaginal region, ending in an explosive release. False orgasm is where pre-orgasmic intense arousal occurs and one presumes to have had an orgasm. A description of the issue. Female orgasmic disorder is defined as having infrequent, delayed, or no orgasm, or having less intense orgasms approximately 75% to 100% of the time. Primary orgasmic disorder (POD) is the most severe form of disorder, involving a total and lifelong lack of orgasms in all forms of sexuality, including masturbation. POD was first defined as a category of sexual disorder by Masters and Johnson. Their conceptualization was widely accepted. It afflicts perhaps 10% of the female population. Secondary orgasmic disorder, which is a more frequent one and affects many women, involves infrequent, delayed, or having less intense orgasms. Depending on the research study, 9 to 63% of women experience problems with orgasm. This is a large amount, taking into account this is about uh, uh, 2/3 of all women. This is a very big percentage. Lack of stimulation. Most women need between 20 and 30 minutes of sensual and sexual touch to achieve orgasm. An average man takes between 2 to 5 minutes to achieve orgasm. So we see there is an imbalance right here, because by the time the man is finished and, and has had his ejaculation, which is orgasm, the lady still needs 15 to 20 minutes, you know, to be able to reach climax and have orgasm. Having the right amount and type of stimulation to the entire vulva, and especially and specifically to the clitoral tissues, can be vital for most women to be able to experience sexual arousal leading to orgasm. So women need to know their vagina very well, to know what is the clitoris, what is the labia majora, labia minora, all these parts. They need to know them, the vulva, so that they can be able to once they know their physiology, then it will be able to easy to know which parts are more sensitive and how they can be able to enjoy the sensual and sexual touch. Etiological factors. Problems in the marital relationship, like high conflict, low emotional connection, uh, lack of enough stimulation, medical conditions, and medications. Medications such as antidepressants, for example, SSRIs, chronic illnesses such as diabetes, psychosocial molestation, abuse, health, psychological, for example, depression, anxiety, fear. All these things, they affect female orgasmic uh, disorders. And surgeries, hormonal fluctuations due to age, birth control, and also surgeries affect also hormonal, they bring hormonal fluctuations. Here we have also a diagram of the human sexual response cycle. And here, according to Masters et al. And Kaplan as well, we see that the, they discover that a normal person starts with the desire, then moves to arousal, then moves to plateau. Then after plateau, if stimulation continues, then they reach orgasm. If stimulation does not continue, or the person does not get overexcited, does not reach climax, then they go back to resolution. For a man, they reach orgasm once, then they go back to resolution. But for a woman, they can be able to reach orgasm multiple times, once or multiple times, and be able to come back to resolution. DSM 1952. This is the first edition of DSM uh, on psychophysiological genitourinary disorders include some type of menstrual disturbance, dysuria, and so forth, in which emotional factors play a causative role. This is all they had to say about female sexual function. They didn't have much really to talk about female, especially about orgasmic disorders in female. DSM-2, female on female sexual dysfunction. Uh, it is similar to the first one, though it adds dyspareunia and impotence to the examples listed that I've talked about earlier. Little detail is given and not comprehensive. An etiological process is posited, and it is the process rather than its specific manifestation that is salient. DSM-3 on female sexual dysfunction, it is significant with the DSM-3 from the previous one. Shift from psychoanalytic to biological psychiatry. Influence of Adolf Mayer's psychobiological framework in the manual, which stressed concepts of adaptation and maladjustment to environmental influences, and posited a continuum between the healthy and the sick. Female orgasmic disorders officially recognized for the first time and is called inhibited female orgasm. DSM-4 on female sexual dysfunction. The concept of inhibition no longer featured, and accordingly, inhibited female orgasm was renamed female orgasmic disorder. The essential feature of the disorder remained the persistent or recurrent delay in or absence of orgasm following a normal sexual excitement phase. DSM-5 on female sexual dysfunction. Basically, the term psychosexual was chosen to highlight the prevailing assumption at the time that psychological factors were of crucial importance in the etiology of sexual problems. Sexual dysfunctions in DSM-5 now requires a period of approximately 6 months of symptoms to meet the criteria for diagnosis. DSM-5 explains that female orgasmic disorder is characterized by a significant change in orgasm, such as reduced intensity, delay in frequency, or absence of orgasm. There is not much change there. Systematic family perspective views impact and influence of or from systemic context of societal, cultural, spiritual, familial, and marital systems towards female with orgasmic disorder. Sexual difficulties negatively impact intimacy patterns. The most common of these difficulties is that over time the couple becomes avoidant of sexual interactions and often any physical interactions. Here we see avoidance in action in this couple. Some people used to actually think and believe that women having orgasm is abnormal and harmful and is not healthy for them. This was very backward thinking, and this is how far a society can go. The media also has not helped. The media is portraying that having erotic and highly passionate scenes, which is really not normal, you cannot have that all the time, and that if you don't have that, then you don't have a normal relationship. In the 1920s and 30s, men were putting so much pressure on their wives to achieve orgasm, and this was leading even to more frustrations. Feeling less of a person for using medication to achieve sexual pleasure and orgasm is also part of uh, the result of what culture can bring and put pressure on women. Some cultures introduced female circumcision, which is actually female genital mutilation, FGM, in attempts to control women's sexuality. And unfortunately, many of these are organized by women and to do this to young girls. And they're claiming that they are demasculinizing women, and this is practiced in Africa, Asia, Middle East, and they lead to many medical health challenges and kills the ability for a woman to be able to have orgasm. Current practices. These involve sexual medicine treatment, treating underlying issues such as pain, arousal, desire, vaginal dryness, hormonal treatments, pelvic floor, pharmacotherapy. Sex therapy treatment involves intimate communication, resolving conflict around sexuality, working on overall intimacy, sexual touch exercises. Psychological treatment involves treating personality pathology, dealing with the conflicts from the roots and not just fruits, self-image. Psychotherapeutic treatment, anxiety reduction and desensitization, performance anxiety, helping each other to relax and enjoy, reducing spectatoring. Traditional interventions, psychoeducation, bibliotherapy, traditional sexual skills training technique. Final remarks. Women should strive to reduce anxiety as well as their husbands. Women should understand that they were created to enjoy sexual pleasure, and if they seek to achieve orgasm, they should seek it for their own selves, for their own enjoyment. Husbands should also be supportive and not put pressure to their wives. There is hope and you can get help. Here are my references.